Hello, and a very warm welcome to the third and final webinar of the Autism at Manchester 2020 webinar series. My name's Cathy Leadbitter and I'm the events coordinator with Autism at Manchester. I want to say thank you very much to you for joining us today. Today we have two really interesting talks for you. Up first is Alexandra Sturrock, and Alex is going to be talking about the language and communication profiles of autistic females without intellectual impairments, their strengths and weaknesses, and the impact that these things have on their lives. And then after Alex, we have Sophie Langhorne. And Sophie is going to talk about her study, which is looking at the complexity and diversity of parents' language and how that affects the language development of their autistic child. Just to say, we're aiming to be finished by around 6 o'clock. We might go a few minutes over just because we do have the two speakers and it'd be nice to have plenty of time for questions. So we may run over by about 5 minutes or so, but obviously feel free to stay on or to leave if you need to. So before I hand over to our first speaker, Alex, I'd just like to give a brief introduction to Autism at Manchester so you know who we are. So Autism at Manchester is a community of academics, students, professionals, autistic people, family members and other stakeholders. Our key aims are to achieve quality research with real meaning for autistic people and to share knowledge and understanding around autism research and to collaborate on the selection, design and conduct of research. I'd like to invite you to connect with us. You can visit our website, autism.manchester.ac.uk, and on the website you can read lots about what we get up to and what Autism at Manchester is. You can also use the website to sign up to the mailing list. You can also connect with us via our Facebook and Twitter accounts, both by entering Autism at Manchester into the search. So this is the third of our seminar series. We've already carried out 2 webinars. The first of these was by Dan Poole, and he was speaking about time perception and autism. And the second of these was by myself and my colleagues, Louisa, Kerry, June and Amelia. And we were talking about the development and piloting of a post-diagnostic programme for parents of children recently diagnosed with autism. Both these webinars can be found on the YouTube channel where you are now. Please feel free to have a look at them. They're both really interesting and you can just hear more about the autism related research that's going on at Manchester. You can post any questions that you have for our speakers in the YouTube chat. I will be accessing that and then I can pass any questions on to Alex and Sophie. So, you know, we really encourage you to do that. It makes it much more interactive. And also just to mention that the webinar will be left up on YouTube for weeks or months after the webinar, and it will be linked to from the Autism at Manchester website as well. So please do feel free to share it with anyone else who might be interested in hearing the talks today. So I'm now going to hand over to Alex. So I'm just going to stop sharing my screen and allow Alex to share her screen. And while she's doing that, I'll just give her a little introduction. So Alex is a specialist speech and language therapist and a lecturer at the University of Manchester. Her clinical work and research looks at communication and language in autistic children and adults. She recently passed her PhD with flying colours, I might add, and it was an excellent thesis. And I know this because I was one of her examiners. It really was a pleasure to read it. Alex also founded the Aspire Network, which brings people together to raise awareness of the female presentation of autism. She's a really strong proponent of improved diagnostic and support services for autistic girls and women. So over to you, Alex, when you're ready.
Hi, hello everyone. It's a shame I can't see you, but I'm assured you're all there. Okay, so yeah, this talk's about half an hour, and I'm going to talk about 3 different studies that were part of my PhD. So there's quite a lot to get through, and I'll sort of draw some conclusions. The series of 3 studies were looking at autistic females. They were children in middle childhood without intellectual impairment, and what I'm going to focus on today is their profile compared to autistic males from the same group and TD females. It's a very clinically driven study based, as Kathy said, on my background as a speech and language therapist. So hopefully of interest to you from that point of view. Oops. Okay, so just want to start off, I think a lot of people accessing this will already know that we know that males are being diagnosed more commonly than females with autism. And it might be that as an average, that's about 3 males to every 1 female. But the problem really is that actually, if you look at different IQ groups, autistic females are being diagnosed in even fewer numbers when they're in the higher IQ group. So this is a group that is commonly going undiagnosed. And so that was the group that I really wanted to look at in my study. And this comes from working in a diagnostic setting with this kind of higher IQ, normal range IQ group as well. So I wanted to know what was going on. Why were this group of females not going diagnosed? What we think is going on, the literature seems to suggest that this group are being missed from diagnosis for various reasons, but it might be that they're being misdiagnosed with different disorders, and those might be neurodevelopmental disorders, or they might be mental health diagnoses. But either way, they're not getting the diagnosis of autism. And when they do, if and when they do get it, they are getting it usually later in life, which means that they are missing the accurate and timely diagnosis that they need to get interventions in place for them. Why is this happening? Why are they getting missed? Well, a lot of discussion is around the fact that actually it's because what is commonly understood about autism is based on a male presentation of symptoms. The history of research, the history of diagnostic criteria is mostly gained from autistic male sample groups, and so females are being underrepresented. An example of this might be if you ask the average person on the street to describe what autism looked like, they're far more likely to say something like something about a savant or a little professor, or maybe a non-verbal boy lining up cars in line or something like that. And they're much less likely to maybe talk about females who have a special interest in acting or have special skills in pitch perception. And they're very unlikely to talk about girls who have a lot of empathy and social motivation, but are unable or have limitations in how they present that. So these features are more likely in a female autistic group and therefore are being kind of missed. Okay, so why study language? Well, first of all, I'm a speech and language therapist and I'm really interested in speech and language. Also, clinically, I was noticing differences, but not really able to spend the time I wanted to spend on understanding what those differences were. But when I looked at the literature back in, I think it was about 2011, 2012, when I started doing diagnoses, I was looking for information about autism in females, and there really wasn't that much stuff out there. Since then, we've had a swathe of research. There's quite a lot of evidence now supporting different patterns of restricted and repetitive behaviours and interests between the female and the male presentation. And there's quite a bit of evidence suggesting social interaction differences between those two groups, but less about social communication. It is still a key feature in autism, which is important to diagnosis, so I wanted to look at this. The other reason I wanted to look at it is because there are differences in a typically developing population between typically developing females and males. And so why wouldn't there be a difference in the autistic population as well? So that was my rationale for targeting this. So what I'm going to talk you through, and I apologise that I'm going to go fairly quickly through some of the methods and the results, because I want to give you an overview of what we found. But I'm going to talk about 3 different studies. The first one is, it looks at direct assessment of language and communication skills. The second study focused on report measures by parents and the children themselves, and also focused on clinical observations. And the final study looked at in-depth interview with the children and gave some real good insight into the actual impact of these kinds of communication difficulties as described by the children themselves. So this is our participant groups. Just to point out, we had 13 people in each group, 13 autistic girls, 13 autistic boys, 13 TD girls, 13 TD boys. It's a small study, but because we were doing such in-depth analysis, we really wanted to constrain that a little bit, otherwise it would have been too big for my PhD, but we are aware that it's a small study, so there's limitations in that respect. We had very good similarities between the groups on different measures, but we had slight differences on performance IQ, so that's been corrected in the analysis. Age was similar between groups. So first of all, I'll quickly talk you through some of the materials we used in study 1. So like I say, this was a very clinically driven study, so I wanted to kind of cover what I would cover if I was going to do a thorough language and communication assessment of a child that came into my clinic. And so I wanted to look at expressive production of language versus receptive comprehension of language. And I wanted to look at word level, vocabulary. I wanted to look at sentence level. And I wanted to look at above sentence level, so that would be sort of narrative level. And I wanted to look at other things as well, like semantics and pragmatics, so contextualized use of language through direct measures and language of emotions. Not all of these items have standardized measures that I felt could differentiate the groups at the level, the intellectual level that we were talking about. So some of these I've used standardized measures, some of these I've used experimental measures, and some of them are novel. If you want to know more about the measures, you can ask me about that, or they're in the paper if you'd like to know more about that. But I will just talk you through the experimental and the novel ones a little bit. So some of the experimental ones, we used adaptations of material by Mackay and Shaw to present some online, through a computer. In the original, this was done through paper-based assessment, but in the one we did, it was on a computer. So we used materials to look at figurative language, but it was largely based on the Mackay and Shaw paper from 2004. And we also used experimental measure by Jolliffe and Barron-Cohen, which looked at bridging coherence. Now, these both tested pragmatic inference, and we adapted the Jolliffe and Barron-Cohen one, which had originally been presented with adults, to adults, and we adapted it so it was suitable for middle childhood. We also developed 2 new measures for the language of emotion, which we wanted to look at. So we had a receptive language of emotion task where we asked the children to name, we would provide the target word. So for example, here we have interested, and then we provided pictures, and the child would point to the correct, hopefully the correct target word in the picture. And there was 37 items in total, and the important thing about this novel measure was that it covered a range of abilities. So all the way, words starting at happy and sad, so maybe developed about 5 years old, going right the way up to words developed at 16 years old. For example, mystified. And we also developed another new measure, which is largely based on the KELF. So we presented a series of tasks where the child had to name words from a category. And this is taken from the KELF. So it's a 60-second word generation task. And they would generate words, for example, on occupations, food, animals. And we just extended that one more time, and we asked them to also do it with the category of emotions. So we got some data about word recall and generation for emotions. Okay, so this first study, all of which is all direct assessment, we got very much what we were expecting in terms of the results. First of all, we found out there were no significant differences on basic language measure. So that, if you remember, is word and sentence level. No particular differences on that, which was good news. As soon as you got higher than sentence level, though, as soon as you went to above sentence level, there were differences. So in narrative tasks, the autistic group were performing less well than the typically developing group. And that was both genders. So there were difficulties for the autistic group in providing and listening to narrative. Where we found group and gender differences was on measures of pragmatics, and this will go across this and study 2 actually. But in study 1, we were looking at direct assessment of pragmatic inference, and we found that autistic girls performed better than autistic boys on tasks of pragmatic inference. And that is things like figurative language, if you remember. And they performed less well than typically developing females. So they were in the middle of these two groups. And this pattern will persist on a number of other tasks that you will see. For example, it occurred on a number of the semantics tasks. The semantics tasks that weren't to do with emotions. So animals, food, and occupations all saw the same pattern. Autistic females performing centrally, autistic males performing less well, and typically developing females performing best. This is important because if they are performing less well than typically developing peers, you can see that even though they seem to have a more subtle presentation of difficulties compared to the males, they're still having some difficulties which will prevent them from performing on a par with their typically developing peer group. So subtle but important differences. Interestingly, when we added emotions to this semantic task, the pattern changed a little bit. On these slides, it's depicted by purple. And we have their differences with the autistic girls performing the same as typically developing girls, and the autistic boys performing the same as typically developing boys. This is a small sample and a novel measure, so we can't say too much, but it might be that this is of interest in the future and for future research. When we looked at receptive vocabulary of emotion, we saw the same slanting pattern that I've described before. Autistic girls in the middle, autistic boys performing worse, TD girls performing better. So this pattern seems to be a bit consistent over a number of different measures. Yes, and I should also say that not only is that what we can see overall is that autistic girls are just having a different pattern than any other group. So they are in some cases performing similarly to TD females. In some cases, they're performing similarly to autistic males, and in some cases, they're performing similarly to no one, and they're just doing they're just performing somewhere different and in their own bracket. And so that's all important, because overall that means their pattern, their profile of performance is just different. So then study 2, we looked, if you remember, I said we looked at things like functional communication, and we measured that by 3 main measures. One was the Pragmatic rating scale, which was an observation of pragmatic behaviours during semi-structured conversations, so conversations about a specific topic. And we use the Pragmatic rating scale for that. And the Pragmatic rating scale is useful because it tells us about the language the person uses, the pragmatic behaviours they have, and also about how they use their language in context. So there's a number of different things they use there. So that is really useful. We also have the parent report was measured using the child communication checklist, and child self-report was measured using the child self, the communication checklist self-report. And again, these are useful tools because they measure language, pragmatics, and social interaction skills. Okay, so without going into too much detail, first of all, what we found was when we looked at pragmatic behaviours, we did find the same pattern as we'd found in our pragmatic inference tasks. And again, that is autistic females performing in the middle, autistic males performing less well, TDs performing best. And when we looked at the pragmatic rating scale, we found that that was driven by some things we might expect, like better non-verbal communication for the autistic girls and better discourse management for the autistic girls. So that was pretty useful. When we looked at the self-report and the parent report, interestingly, we didn't find any gender differences, just group differences. And we'll interpret that later, but it might be that they're not experiencing gender difference, even though they are having subtle differences in their profiles. Then what we did was we looked and we compared the findings from clinicians' reports and parent reports and child reports. And I'm just going to really read through this because I think it's the best way of summarising it, really. But so clinicians identified fewer difficulties for autistic females than their parents did. And that was compared to all other groups. And so what that might mean is that girls are covering up some of their difficulties in the clinic. And so clinicians aren't really seeing it. And parents are seeing more difficulties than clinicians are seeing. We also found that clinicians were reporting fewer difficulties than the autistic females themselves reported. And that's interesting. We don't really know why that happened. There's not really any other data particularly on that, but it might be that girls are better at identifying their difficulties than maybe the clinicians are aware of. And interestingly, we can compare that to what happened for the boys, and the autistic boys reported, the clinicians reported more difficulties than the autistic boys reported for themselves. So girls are reporting more difficulties, boys are reporting less difficulties. And interestingly, how the girls reported was actually quite similar to how TD children reported. So TD children also reported more difficulties than clinicians. It's quite confusing data and we don't entirely know what it all means, but one thing it could mean is that autistic girls are reporting their difficulties in a similar way to TD children, and maybe that means they are slightly better at reporting than the autistic males. Maybe the autistic males are underreporting their difficulties because they're not really understanding all the difficulties that they're having, and this may be to do with sort of self-reflection skills. Again, we don't really know. I want to get on to the final study, which is the interview data. which was extremely interesting. We wanted to include children's self-reports, and we wanted them to be able to elaborate on their difficulties and how this impacted on them. And so qualitative was a really good way of doing that. We looked at a subset of participants. We had 6 girls, we had 6 boys. All 6 boys were recruited from the original study. Not all of the 6 girls were, and we struggled to get them to re-engage with the project. And it may be because, if you see, they would have all actually been in the 12 to 13 year age bracket. And it might be that the autistic girls were having particular troubles around that time, just the first year of secondary school. And so maybe they had enough on their plates. So we had to re-recruit a number of girls to take part in the study. But we used a lot of interesting strategies that we developed in line with the autistic community, with Autism at Manchester, and we were able to get really excellent detailed self-reports about language and communication difficulties, strengths and difficulties, and also where it impacted on their lives. So we found, these are some of the themes that we found. So the children reflected on their communicative ability. They identified strengths in vocabulary and difficulties with listening for meaning and social conversation. We also found that one of the impacts of subtle communication difficulties was self-advocacy. Explaining events, explaining thoughts and ideas, explaining feelings. These were all identified as problematic for the children. We saw an impact of social communication difficulties on relationship building, and the children talked about that in some detail. And we looked at literacy and the crossover between communication and literacy. We felt that literacy might be an issue, might be a strength for these children. We wanted to highlight that, and in fact the children talked a lot about how literacy could be a useful strategy for them. There is also the overarching category of emotions, and that has an impact on a number of different areas, and I'll talk about that in a second. So nearly all of the children talked about listening difficulties. I won't read the quotes to you, but nearly all of them talked about listening difficulties. The one thing we realised was that that the underlying cause of those listening difficulties was not the same. So every child did not report the same types of listening difficulties, but they all reported some listening difficulties. And in fact, I'm part of a study that's looking at identifying that in a little bit more detail currently. But certainly when it came to following detailed instruction, the children described difficulties with that. Nearly all of them described difficulties with subtle language and communication difficulties impacting on explaining their own thoughts and ideas. And this was often linked to very negative emotions. So the frustration levels of not being able to explain yourself, not being able to explain an idea or an event, was actually having a very impactful an impact on the emotions of the individual. This was increased, the level of difficulty was increased when it came to explaining emotions, because you not only have a narrative impact, but you also have an impact of maybe not being able to talk about not knowing the vocabulary of emotions. And so some of the children described not always being able to find the right words to talk about emotions. Some talked specifically about not having the words to do it. But there were other factors, and one of the other factors that was identified by the children was that they didn't really understand why they would want to tell someone else about their emotions. Why would they do that? So there was definitely some specific language elements that were limiting them, but also the children identified other things as well. For example, not being sure why they needed to do it. There was also a definite impact of language and communication skills on social communication difficulties. The children really identified that one did equal the other, and it wasn't just about social interaction difficulties, but also there was a practical element of not having the right vocabulary, not really understanding the processes, and not being able to process information quickly enough or find the right words quickly enough. So we did find evidence that it was language and communication directly impacting on social relationships and social interrelationships. But again, there were other factors that the children brought up, and for some, there were examples of other factors. For example, not understanding the social themes that were interesting and not really knowing what to talk about, and that's more of a social cognition type of problem. We definitely found an interaction between communication difficulties and emotions, and lots of these problematic areas that the children described did come associated with an emotional response, and we collected all the emotional responses and all of the difficulties from word finding through to difficulties with listening through to conversational skills entailed this kind of negative emotional response. But importantly, there does seem to be this interaction between language and emotion. We know that language difficulties can cause frustration, and we know that heightened anxiety can reduce communicative skills. So there's this kind of bi-directional difficulty, and it seems that that is also being experienced by these children in the autistic community. So the overarching themes for females here, because we did look at themes of gender as well. It was a small sample group, but we were just looking for indicators of difference according to gender. We found that the females did seem to be more motivated for things like social chatting and making friends, although they reported similar levels of difficulty in doing so as the autistic males. They reported more difficulties with fitting in with their TD peer group, and could elaborate on this. And they also described very different ways of using literacy to support their social development, which was very interesting and part of the strategies that section of what we put together. They did seem to demonstrate a greater degree of self-reflection, and maybe this supports the findings from paper 2 that I talked about. They were better able as a group to self-reflect and then to explain that in rich detail. So the conclusions of my study, just going back and looking at the whole thing as one, autistic females do seem to be better than autistic males on measures of pragmatics, semantics, and language of emotion. And they do seem to still have difficulties compared to typically developing females on measures of pragmatics and semantics. A general overarching point for any clinicians listening is I would never recommend assessing this group of children using only word and sentence level tasks. As you saw, they all perform the same on word and sentence level tasks, but we were still seeing difficulties in this higher level language ability, including narrative. Importantly, in the reports from parents and children, they did not see their difficulties as less if they were females and more if they were males. They experienced a similar level of difficulty, and that may be because they're comparing themselves to their TD peers rather than to the other autistic population by gender. But autistic girls may experience some of their difficulties differently because of the social impact, and so that's important as well, and we need to understand the social impact of language difficulties for this group. Parents, particularly of autistic girls, seem to identify more difficulties than clinicians on language and pragmatic measures. And as I said before, I think this means that if we were going to interpret that into clinical practice, what that means is we must listen to parents, because we may not see difficulties in clinical sessions and parents may see more difficulties. Final comments. So autistic children were able to identify their own language and communication difficulties. I think that's important because, again, in clinical practice, that means we should be including them in assessment and target setting. We did have to go to some lengths to make that workable, but it can be done, and if it can be done, then we should at least attempt to do that in a clinical setting. This may be even more prevalent and important for the autistic girls because they seem to have better reporting skills. And so we really should be including them in identifying their difficulties and target setting. Both groups described how this subtle presentation of problems, language and communication problems, did have an impact on all sorts of things. And we talked about self-advocacy, so functionality, social interaction and social interrelations, and emotions. And it's important, therefore, that we think about language and how it impacts on all those different things. Okay, that was a whistle-stop tour of my 3 studies. There's my various people who've helped me along the way in my research, and now open to questions.
Thank you so much, Alex. Thank you for that wonderful talk. It's so important for us to understand more about the presentation of autism in girls, and particularly, you know, girls without intellectual impairment, and how that's sort of similar and different to autistic boys and also to neurotypical girls. So, I love your research anyway, and I've got, 2 family members who are autistic girls, and it's just so important and so relevant, and we really need this kind of work. So thank you so much for your research and for such a lovely presentation as well. So we've got a couple of questions. We don't have time for too many, just because we do need to make sure Sophie's got plenty of time. But I could ask sort of 2 or 3. So first of all, have you conducted any research, or do you know of any research into how autistic teenage girls struggle with understanding and using sarcasm compared to boys? So kind of gender differences in understanding and using sarcasm?
I don't know that has been done. I don't think that has been done at this date. It would maybe build on the task that you saw that we did for pragmatic inference, and that was figurative language. So sarcasm would be a type, can be a type of figurative language, and so it might be that certain tasks like that would be helpful to identify problems. I really am interested if the person who's asked this question has got a thought about this, whether they actually do think that there is a gender difference. Because if our study is anything to go by, you might say, well, the autistic girls might understand sarcasm a little bit better than autistic boys. I'd be really interested to know what they think.
So that question was asked by Katie Boswell, and she's interested in a possible dissertation on this theme. So it sounds from what you say that would be a really good idea, that we need more research into that area.
Yeah, lovely, yeah.
Excellent, okay. Is it possible that qualitative research could be done on older girls that have been diagnosed with ASD to see if any similarities of behaviours can be uncovered, which might aid earlier diagnosis?
Oh, okay. So similarities of behaviours, I'm assuming between autistic girls and boys, or it could be between autistic girls and TD girls. So I'm not entirely sure, but I mean, I'm quite a big believer in qualitative research, especially around areas where we don't know much about the subject matter. And of course, there's absolutely tons that we don't know about autistic females. So qualitative research is great because you can really get in there and talk to the community and find out what they think in a very, and then analyze that data, and that can point us in the direction of future research questions, of course. So yes, I think the answer is yes. I'm sorry if I didn't quite understand what you were hoping to investigate, but the answer would be yes anyway, definitely.
Great, thank you. Okay, just time for one more question, just because I'm conscious of time. And someone has asked, do you think that there's a role for the CCC in diagnostic assessment?
Ooh, also interesting. I mean, as a speech and language therapist, working in a diagnostic team, I would always try and use some language measures, because I think that it does help understand the profile of the individual. And in that case, it helps with, we never just do diagnosis, we always do diagnosis with recommendations. I'm not entirely sure if you would use the CCC2 as a diagnostic aid as such, but we're sort of moving towards thinking about the profile of strengths and difficulties for the individual and making intervention targeted and recommendations targeted for the individual. So in that sense, I would definitely want to take some language measures, higher level language measures, and the CCC2 could provide that. Personally, I'd probably like a mixture of that and maybe some kind of direct assessment as well, because as you saw, the CCC2 didn't really measure difference between autistic girls and boys. Whereas some of the direct assessments did. So the pragmatic rating scale did, and that did it very well, actually. Yeah.
Lovely, thank you. So we'll leave it at that. Thank you so much once again, Alex, for your talk and for taking time to answer the questions today.
If anyone wants to email me, that's absolutely fine with other questions. Okay, thank you.
Thank you. Okay, so we're now going to welcome Sophie Langhorne. So Sophie, if you want to share your screen whilst I'm just giving you a little introduction. So Sophie is a postgraduate research assistant with the Social Development Research Group at the University of Manchester. Sophie completed a master's in clinical and health psychology. Her thesis project looked at the social and communicative abilities that underlie language development in autistic children. It was a really fantastic piece of research. And she's extended this work to look further at parent-child interaction and language. And this is what Sophie is going to talk about today. Just to add to that, Sophie is passionate about improving our understanding of neurodevelopmental conditions and improving our understanding of how to support neurodivergent children and their families. Thank you. Over to you, Sophie.
So I'm Sophie, and today I'm going to talk about how the complexity and diversity of parents' language can affect young children's language development. So I've worked on this with a team of people from the Paediatric Autism Communication Trial, and then I've also worked with some people from the Lucid Centre at the University of Manchester as well. And then I've also had the help of two coders, Amelia and Catherine, that have helped me to code all of this data. So what I'm going to talk about today is, why did we investigate parental language in the first place? And why might this be important to helping us to learn more about autistic children's language development? So I'm going to talk about the different parts of parental language and communication that I measured. So I looked at parental language complexity, so the length of parents' utterances. I looked at the diversity of their vocabulary. I looked at how much parents spoke to their children while sharing attention with them. And I also looked at the synchrony of parents' language. And I'll explain a little bit more about what synchrony is in just a moment. After this, I'm going to just tell you a little bit about my analysis of the relationship between these parent language and communication variables. and the relationship with children's comprehension and children's speech change over 12 months. And then I'm also going to talk a little bit about my investigation into whether this relationship differed depending on children's different abilities. And then I'll summarise my results. So firstly, I just have a little rationale about why we did the research. So currently, there's lots of conflicting research claims in the literature that suggest different ranges of parental language inputs are important for helping children to develop a language. So firstly, it's debated about the importance of synchronous language. So when I talk about synchrony now, I'm referring to language that really focuses on what the child is focusing on. So this might be labels or comments about something that the child is playing with or what they're doing. It really focuses on what that child is doing in the moment. And when I talk about asynchronous language, I'm talking about language which isn't focused on the child's focus, and instead it's focused around perhaps giving children instructions or diverting the child's attention or giving them demands. So there's currently a debate about the importance of synchronous and asynchronous language in the literature. So although a lot of research has shown the importance of synchrony on improving children's social communicative skills, so for example, the PAC trial has shown that improved parent initiations, improved parent synchrony, has improved child's initiations so their social communication skills are improved. There's not that much research that strongly suggests that synchrony is related to language, and the findings are mixed. Now, in addition, there's quite a lot of debate about the importance of using simple and short utterances versus using longer and more diverse utterances. So a lot of the literature suggests the use of simple and short utterances can be really beneficial to helping autistic children to develop their language skills. And a lot of interventions currently use this information to guide their practice. However, research is now coming out more and more commonly to show that actually longer and more diverse utterances might also be beneficial to help children to learn language. So there's two polar opposites of theories here that are competing, which need to be explored. And there's also a debate surrounding how important it is for parents to share attention with their child to improve their language skills. So because of this mix of evidence, we thought that there was a real need to synthesize the data on all of these areas, because each of these areas may be separately beneficial to helping autistic children to develop their language. Now, in addition, we thought the diverging results in the literature may occur because there may not be a one-size-fits-all theory that helps all autistic children. So as we know, autism can affect different people very differently. So perhaps just one theory may not help all autistic children to develop the language, and instead it might be that parents need to match their inputs to their child's abilities. So from this rationale, we developed a theory. So we said, well, perhaps if parents spoke more while sharing attention with the child about the child's focus of attention, so they were synchronous with the child, perhaps this would mean that the child wouldn't have to divert their attention. And this would then mean that the child has more time to process what's being said because they're focusing on what they're listening to. And that may give them more opportunities to map what they're hearing onto objects around them and enable the language learning. Now, if parents then add in utterances that are perhaps less complex and diverse to help autistic children who may have less speech and a lower level of comprehension, this may help those children to understand what the parents are saying and therefore improve their language skills. In contrast, if parents use utterances that are more complex and diverse whilst talking with children with higher levels of comprehension and speech, then perhaps this will allow the children to obtain more learning opportunities and their speech will improve also. So how did we investigate this? Well, we examined 4 different aspects of parental language that we thought would be beneficial in helping children to develop their language. So we measured these variables using a video coding measure, and this is used to identify very specific behaviours. And we analysed the language and the communication between 48 parent and child dyads. And the videos that we used were from the Paediatric Autism Communication Trial, and we coded 8 minutes of each of these videos, and we transcribed and analysed all the behaviour in these 8 minutes. So we also had different researchers assess these behaviours and code the videos, and we had excellent agreements between the raters, an agreement of 0.09. So we were confident that we were accurately measuring our variables. Now, these variables were language complexity. So we measured the length of parent sentences relative to their child's. We had language diversity, whereby we measured the diversity of the parent's vocabulary relative to their child's. And this was a score really of how many different words the parent said that the child did not. And then we also measured synchrony, so the number of synchronous utterances spoken by the parent. So this is the number of comments that related to the child's focus of attention. And then we also measured the number of utterances the parent said while sharing attention with their child. So those were our parent variables, and we measured child language change with 3 different outcomes. So we measured child expressive language change. So we looked at the change in spoken language over 12 months. We looked at child receptive language change, so the change in comprehension over 12 months. Now, these 2 measures were measured using the PLS-3, which is a standardised measure used to assess language skills. However, because it's a standardised measure, this means that it's not necessarily made to measure specific autism language, so there may be some bias within the measure. So to counter this, we also measured the change in the length of the children's utterances from the videos. And this was more of a natural measure of language change from baseline to endpoint, so over 12 months, to account for any potential bias that may be present in standardised tests. So what did we find then? Well, we conducted some correlations to see if the parent variables were related to the child outcomes. So this is for the whole sample, and we have each of the child variables is each column. So if you look at the first column, you can see here that we found that all of our variables together were significantly related to improvements in child comprehension. And in particular, we found that vocabulary diversity was positively related to comprehension change. So the more vocabulary, the more diverse the parents' words were, the more children's comprehension improved. Now, with regards to expressive language change, so speech, we didn't find any significant relationships between all of our variables together and our outcomes on both the PLS and our natural measure. However, again, when we looked closely at the relationships, we found again that parental vocabulary diversity was positively related to children's speech development. So again, the more diverse that parents' language was, the wider their vocabulary, the more children's speech improved. So it became quite clear here that diversity within parental speech was very important in helping autistic children to develop their speech. So then we wondered if this relationship differed between children with different abilities. So what we did then is we split the children into 2 groups. So we split the children depending on how many words that they could speak. So we had 22 children who were minimally verbal, who spoke less than 5 words, and 26 children who were verbal, and these children spoke more than 5 words or were able to speak in phrases. And we split the children into groups using the A1 score on the ADOS, which is commonly used to split children into groups based on their language abilities. So what did we find when we split the children into these groups? Well, you can see here that we don't have many bold categories, so that shows that we didn't really find many significant relationships between the 2 groups. However, if you look at the row for minimally verbal children, so the children that spoke less than 5 words, we did find some significant relationships with their speech measured by the PLS-3. So we found that all of our variables combined were related to child's speech, so improved speech. Now, when we look closely at each of the variables separately, we found that higher diversity of parental vocabulary was positively related to child speech. So the more words that parents used, the more improvement there was in child speech. Now, this was surprising in a way because these children were speaking less than 5 words, but the more words the parent used, the more their speech improved. So this was really beneficial. Now, in addition to this, we found that actually the length of parent sentences had a negative relationship with child speech. So the longer parent sentences were, the less the speech improved. So perhaps it's more beneficial to use shorter sentences. And in addition, we also found that synchrony actually had a negative relationship with child speech, which was surprising. And the fact that the more synchronous parents were and the more they talked about the child's focus, the less child's speech improved. So how can we interpret all of this? Well, for the sample as a whole, we found that parental vocabulary diversity was the single most significant factor, and this was related to both child speech and comprehension growth within the PLS-3. And this was also shown on a naturalistic measure in child speech. So we know that parental vocabulary diversity could be really important. And this relationship was positive, which suggests that children showed most language growth when their parents used a much greater vocabulary than the child did. So we could ask the question then, is it the greater the parent's vocabulary, the better the language growth? Now we have to be careful here because we're not sure which one of these factors is driving the relationship, and it could actually be that the more the child's speech improves, the more parents improve their vocabulary and widen their speech because the child's speaking more. So this does need further research. Now, in regards to children who spoke less than 5 words, so the children who were minimally verbal at baseline, these children showed the greatest growth in speech over a 12-month period when their parents used a greater vocabulary, so they used a lot of diverse language, when their parents used shorter and simple utterances, so they were less complex, and the parents used fewer synchronous utterances. So perhaps it's the fact that shorter but diverse utterances that are beneficial to help autistic children to develop their language. Now, this fits with the idea that typically developing children need to be able to say and understand a number of single words before they can start putting together phrases and developing complex language. Now, with regards to finding that there was a negative relationship of speech with synchrony, this was unexpected. And so we were starting to think, maybe synchrony inhibits the positive relationship between the diverse vocabulary and improved speech. So we know that synchrony depends on parents following the child's utterances and focus. So if minimally verbal autistic children aren't saying many words and they maybe choose to focus on preferred activities, then perhaps parents may have less opportunities to use a diverse vocabulary when they're being synchronous. Therefore, this reduces the positive effect of parent diversity on child language. And then this may account for the relationship between synchrony and child speech that we found here. So we almost must say here that we can't say anything about verbal children because we didn't find any significant relationships in children who use more than 5 words or spoken phrases. So more research is also needed to see if this relationship continues in verbal children. So what can we conclude then? Well, we can conclude that increased diversity but shorter and less complex utterances may be beneficial to minimally verbal children. And there's a potential that synchrony may reduce this diversity, but further research is needed. And we also had a limitation of a small sample in this study. So we had 48 parent-child dyads included in the study. And then when we split them into 2 groups, they were obviously even a lot smaller. So we may have found positive relationships between our parent variables and child language if we had a larger sample, but future studies would require the analysis of a bigger sample to see if this relationship continues or if it differs in children with different abilities. Okay, so that's me done.
Thank you, Sophie. Thank you. Thanks for that excellent talk and really clear summary as well. I know it's not the easiest study to kind of present in simple terms, so you've done a really good job of giving a nice clear overview there. Thank you for that. So a couple of questions for you. I think we've got time for that, just about. So I wondered whether the parents in your sample, obviously you were looking at the parents and how they use their language, how they use language with their children. Had those parents received any advice already about how to talk to their children and perhaps how to kind of adjust their language for their children?
Yeah, so because our videos were taken from the PAT trial, half of our sample or thereabouts, it might be a little bit either way, we're actually taking part in the PACT intervention, and this intervention focuses on improving parent synchrony. But it was interesting to include children who were receiving maybe an intervention and those who weren't, just so we could see if this relationship carried through in children, you know, despite their interventions, if parent language still affected the language, which it did. So about half of the children, yeah, their parents were being more synchronous, or they were being told to be more synchronous, but we were blinded to if they were or not when we were doing the coding.
Great, thank you. We've had a comment on the YouTube from a speech and language therapy student at Manchester who's really interested in your research and wants to know where she can access your paper.
Ah, okay, so it's still actually being written at the moment, and we're just finalising the discussion now. But then I guess if you send me an email, I'll be able to keep in contact with you, and then once it is published, if you want to still give it a go and read it, then I can send you the details then.
Brilliant, thank you, Sophie. And I'm sure Amelia could pop your email into the chat so people have got that if they want to get in touch to hear more. Okay, just one question before we finish off, and yeah, I think there seems to be a few people who are clinicians, maybe speech and language therapists, who are on the call today. What would be the key messages from your study to share with people who are working with families of autistic children?
I think maybe there's obviously a lot more research that needs to be done into this area. So maybe everything that I should speak, you know, I'm saying now, it's only a very small research sample, but maybe just starting to think about the idea of maybe, you know, not one theory might work for everyone. And it might be, you know, a case of having more person-centered interventions, and maybe increasing that diversity in parent language and just exposing children to more vocabulary, just to increase that diversity of language and those learning opportunities. But again, making sure that the children aren't overwhelmed. So I guess it is just a case of focusing on that child's abilities and tailoring language to their abilities to help them to learn best.
And that's why this kind of individualized therapy is so important, isn't it? Particularly around that kind of tailoring to that individual child's needs.
Yeah.
Fantastic, exactly. Thank you. That's all we've got time for, I'm afraid. So just want to say thank you so much to Alex and to Sophie for their fantastic talks today. Really hope you found them interesting. I'm sure you have. I also want to extend my thanks to Amelia Pearson and Kerry Ellis and Sophie Langhorne for all their help in organising these webinars. And thanks to you as well for tuning in today. Hope you found it interesting. You've got the email addresses of our speakers if you want to get in touch with them with any more questions. And please do check out the other webinars that are on the YouTube channel, and also keep an eye out on our mailing list and our social media for information about future activities and future events that are being held by Autism at Manchester. Thank you so much. Thanks for joining today. Stay safe. Bye for now.